everybody. I am going to share my screen with you. My name is Laura McGelvey, and this is Remote Hepatitis C Care in the age of COVID-19 and beyond. Today, we're going to talk about a little bit about Hep C, a little Hep C 101, safer protocols and alternatives to community-based hepatitis C support, remote patient linkage and navigation strategies, the importance of implementing and of supporting accessible hepatitis C care, and then some of the lessons learned and some of our future goals with Hep C subspecialty care. The See a Difference viral hepatitis program at Philadelphia Fight was founded to provide comprehensive, patient-centered, whole-person healthcare services to individuals in Philadelphia and the surrounding area who are living with or at risk of contracting viral hepatitis, HIV, sexually transmitted infections, and those experiencing complications of unstable housing, poverty, substance use disorder, and other factors contributing to healthcare disparities. All that to say that we are here for everybody. We want everybody to get the healthcare that they deserve, whether or not they're living with an infectious disease or at risk for doing so. So we are a testing and linkage to care program at our heart. We offer hepatitis C cure at the Jonathan Lax Treatment Center, the John Bell Health Center, Broad Street Ministries, our Youth Health Empowerment Project, or YHEP, and we do telecare health with partnering agencies. We do community-based testing at drug treatment programs, homeless shelters, medication-assisted treatment sites, and we partner with the Institute for Community Justice here at Philadelphia Fight to ensure that everybody who is living or incarcerated at the Philadelphia Department of Prisons up on State Road has access to hepatitis C testing and linkage to care. Again, we're a testing, education, linkage, and treatment program housed at Philadelphia Fight. We partner with community service providers to be sure that all those living with or at risk for Hep C and HIV have access to gold standard, the absolute best medical care, and everybody at our partnering agencies and in our entire community are eligible for navigation services, free navigation services, primary care, and subspecialty care here at Philadelphia Fight. Hepatitis C is a contagious liver infection caused by the hepatitis C virus. We call it HCV. It's commonly known as Hep C, which is spread through contact with blood from an infected person. Hepatitis C is the most common blood-borne infection in the United States. For some people, hepatitis C is a short-term illness, but for more than half of the people who become infected with the hepatitis C virus, it becomes a long-term chronic infection. Chronic hepatitis C can result in serious, even life-threatening health problems like liver cancer and cirrhosis. Here I have a little picture of what a nice, normal, healthy liver looks like before somebody is infected with hepatitis C or at the time of infection. And as the years go by, about 75% will develop chronic hepatitis C if untreated. About 25% of folks can just clear it on their own. There's something about them that works to clear the virus, maybe without them even knowing that they were infected. In 20 to 25 years, 5 to 20% of those folks with chronic hepatitis C will develop cirrhosis. That's that hardening of the liver. And 25 to 30 years, we see a lot of end-stage liver disease. We see liver cancer and death. 1 to 5% of people will die from cirrhosis or the liver cancer. Outside of the liver, there's a lot of other conditions that the hepatitis C virus can cause in the body. It can cause a lot of depression and fatigue. We see that in almost all of our patients. By now, we all know what it's like to fight off a cold or maybe even COVID-19, just that feeling of crappiness and you're tired, your muscles ache. That's a lot of the feeling that people get from being infected with hepatitis C. And that's depressing. It makes you tired and you don't want to do anything. There's blood problems like anemia, impaired blood clotting, and blood cancers that we see in folks who are living with hepatitis C. Immune system problems, connective tissue diseases, kidney problems, eye problems. Blood vessels can be affected, and you can have some skin, joint, muscle, gastrointestinal, heart, kidney, and nervous system manifestations when you're living with Hep C. Also, a skin rash. We see that in a lot of our patients who say, I just can't get rid of this eczema, or I can't get rid of the psoriasis. And then when they go on their medication, it just goes away. It's a skin condition caused by the hepatitis C virus. And again, muscle weakness, pain, joint inflammation. You're really, really uncomfortable when you're living with a virus in your body. Most people do get hepatitis C these days from injection drug use. Other people get it from sexual contact with somebody who is infected with hepatitis C. People who had got it before 1992 could have gotten it from a blood transfusion. Some people have no idea how they got it. And there's other things like needle sticks in the medical field, or just any sort of blood-to-blood contact. But mostly we see that people who are injecting drugs and sharing equipment or doses are getting it the most commonly. So we do have to talk about how there's two epidemics intertwined. Hepatitis C infection is a serious health consequence of injection drug use. About 70 to 77% of people who are injecting drugs are infected with Hep C antibody. 1 in 3 people who inject drugs acquire HCV in their first year of injecting. We see that a lot when people are learning how to inject, when they might not have their own equipment, they might not know exactly how to inject, and they're sharing with the people in their injection community. And about 45% to 85% of individuals who are chronically infected with hepatitis C are unaware of their status. They may know that they're at risk for being infected with hepatitis C, but they don't know whether or not that they have it. This next slide, I like to talk about how long hepatitis C can live outside of the body. It can live for up to 64 days in a syringe. It doesn't need to be in your body to stay happy and healthy. Hepatitis C has a really strong, it's called an envelope around the virus. So it can live in a syringe for 64 days. It could live in a water container, like a water bottle, for 21 days. It can live on a surface for 21 days. And then when you're injecting drugs, you may have foil that you're keeping your drugs in, filter like a cotton ball or a cigarette filter, sometimes used when injecting drugs, and it can live for a day or two right in there. It can live at incredibly high temperatures. A Hep C contaminated solution needs to be heated for 85 to 90 seconds, so over 1 minute, at 149 to 158 degrees Fahrenheit for the virus to be at undetectable levels. So sunshine isn't going to necessarily kill it if you leave the bottle of water in the sun. It really, really needs to be heated up. And when we're sharing needles, we can see that if there's high dead space, or the kind of needles with a lot of open space here in the top, can hold a lot of blood, which means that if you're sharing your needles and there's a lot of blood in that little top, you're also sharing your blood. So it's very important to say that hepatitis C does not just live in the needle. It can live in the drugs, it can live in the water, it can live in the cooker, in the cotton, and all of the things that people use to inject drugs. So if you or somebody that you know is injecting, it's really important to share that information, that it's not just the drugs, or I'm sorry, it's not just the needles where the virus is living, but it's every single part of injecting drugs. The universal Hep C screening for American adults is that everybody aged 18 to 79, which is probably everybody who is listening to this right now, should be screened for hepatitis C. If you don't have any signs or symptoms of hepatitis C, that does not mean that you don't have it. It should be part of your routine blood work that your doctor is doing at least one time in your life. If you have any kind of risk factors in your life, including injecting drugs, a tattoo that you might have gotten in a party, if you have a child who is born to a HCV infected parent, meaning the birthing parent, you should be tested for HCV as long as that risk is going on. So as long as you're injecting, as long as you're going to tattoo parties, as long as you're having unprotected sex, and you can talk to your doctor about how often they think that you should be tested. Anywhere between every 3 months to every year is usually the standard. In the pandemic, the CDC had decreed that everybody who is pregnant should be screened during pregnancy. and that's really cut down on the risk of maternal fetal transmission. Testing for Hep C is a two-part test. We want to test for the Hep C antibody. If that is not present, that means that you do not have hepatitis C. If you've had a recent risk, like you were at a party where you injected or got a tattoo, then your doctor may tell you to come back in a few months just to make sure that you're not in that window period where the antibody is not showing up yet. So if you don't have antibody, you can stop the testing. And if you don't have any risk factors, you can be pretty sure that you don't have hepatitis C. If you do have that antibody, we have to go and test for virus or HCV RNA. If it's not detected, you do not have a current Hep C infection, which means that you've either cleared it by yourself or you've been on medication and you're cured. And then again, additional testing as appropriate. If you have a risk factor, you should be getting tested again and again while you still are engaging in risky behavior. If you don't, your doctor might say, you don't have to be tested again unless you think that you've been exposed. If you are detectable at any level, even if you have just a little bit of virus, you have a current Hep C infection, and we need to get you linked to care. Primary care providers should follow CDC guidelines. Again, that's every single person over the age of 18 at least once, and all pregnant people with every pregnancy, even in a pandemic. I know that a lot of us have not been great about going to the doctor, haven't been great about getting that lab work done, but we do want everybody to be tested and know their status. For those who cannot or do not seek primary care, here at FIGHT, we try to make sure that community-based and jail-based screening programs are in place just to reach those who are at greatest risk for hepatitis C. We work to ensure that all FIGHT patients, all incarcerated individuals in Philadelphia, and persons entering specified recovery programs continue to be screened according to the CDC guidelines while keeping everybody's safety in mind. Rapid hepatitis C counseling and testing takes about 30 minutes. It looks a lot like HIV testing with the little finger stick, and we get your blood and we mix it up in one of those little tubes. It takes about half an hour because of the counseling messages that we like to get, and it's also a 20-minute test. That test is done face-to-face, usually in a closed space, especially if we're in a homeless shelter or a recovery program. Because that's not the safest way to be in a pandemic, we sometimes offer direct linkage to either subspecialty care or primary care for folks who know that they already have Hep C or suspect that they were exposed. So it saves us that 30-minute time. We open up a laptop and we talk to the person, is next Tuesday at 9 o'clock good for you? And they say yes, and we get them right on the books for an appointment rather than sitting and testing and then waiting for the test results to come back and then trying to find the person again so we can get that appointment scheduled. Here at Philadelphia FIGHT, providers screen for hepatitis C, HIV, and other STIs during all routine care visits. So that means that when we directly link somebody to care, we know that they're going to get that hepatitis C screening at their appointments here at FIGHT. If a patient tests negative for Hep C, they're offered continued primary care services and supportive service such as other subspecialty care, behavioral health support, medical case management, dental care, re-entry programming, and all other services provided at FIGHT. If the patient tests positive for hepatitis C, subspecialty care begins immediately. Our patient linkage staff performs a lot of well checks with our patients to let them know that we are offering both in-person and remote services. Our team continues to perform street outreach in our most vulnerable neighborhoods. For those of you who live in Philadelphia, you know that that's Kensington, parts of South Philadelphia, West Philadelphia, and North Philadelphia, to attempt to locate patients and clients in need of healthcare services. We do lose a lot of folks in subspecialty care, and we look for them in the jails, we look for them on the streets, and we look for them in homeless shelters and recovery programs. We also keep close contact with the Philadelphia Department of Public Health. They have a hepatitis surveillance team, and while they can't give us too many details, they can say, oh, Joe Smith, he still needs you, keep looking for him. Or Joe Smith looks like he's cleared the virus. He's either been cured somewhere else, or he's cleared the virus by himself. He got cured somewhere else or cleared the virus by himself. The See a Difference team stays in really close contact with our partner and community service providers, and what we call the internal champions, who's just that one person. It might be a nurse, it might be a case manager, it could be an intake worker who really loves what we do. So we hook them in and we make sure that we're in constant contact with them, just to make sure that they know that we are here no matter what, if we're on a lockdown, a quarantine, or if things are running a little bit closer to normal. We want them to know that we're here for our patients. We've increased printed materials that we hand out to our partnering sites, just little flyers, business cards, anything with our name and phone number on it. And we've educated the on-site staff here at FIGHT about what to do if a person mentions hepatitis C or asks for Hep C services. So both in the community and here at FIGHT, when somebody asks about Hep C, we have a pretty easy way for folks to get in touch with us. Clients and patients or their representatives, meaning like a floor nurse or a case manager, can call our office and schedule an in-person or telehealth visit, usually within 72 hours of the call. So even in regular times, we know that patients have several barriers to hepatitis C care. The See a Difference team in Philadelphia FIGHT strive to address these barriers and support each patient in their journey to cure. We know that there's patient-level barriers, comorbidities, like if somebody's also living with HIV or STIs or substance use disorder, competing priorities. Sometimes people just can't make it to the doctor because they have a couple jobs, they're taking care of their mom, they have a few kids at home. Unstable housing, lack of transportation, even though we have a really nice transportation system here in Philadelphia, not everybody has bus fare, not everybody knows how to get downtown from where they're at. A limited knowledge of HCV, whether it's old ideas like we're going to do a liver biopsy or the treatment is really terrible or expensive, or just the knowledge that there's treatment out there. Stigma around hepatitis C. Unfortunately, there can be stigma in certain communities if you are infected with hepatitis C. Prior negative experiences in healthcare settings, which we see all the time, especially for folks who are struggling with addiction or struggling with homelessness, where providers have told them, until you can get your stuff together, we can't help you. Or you don't deserve care because of the way that you're living your life. Everybody deserves care and everybody can get care here at Philadelphia FIGHT. And then people are incarcerated, people are institutionalized. So there's a million different reasons that aren't listed here that people cannot make it into care. There can also be provider barriers, a perceived lack of value in treating some patients, which I just said. We hear it all the time from patients that their doctor told them that it's not worth treating if they're still going to be injecting, or that they are just going to get sick again, so why even bother? Concerns about adherence. We know that people who take drugs are really good at taking drugs, so we don't really worry if you are injecting drugs or using street drugs. We know that you probably are using most every day or on a regular schedule, so we just ask you to take your Hep C med before you're taking your other drugs. It works great. Medical contraindications. There's not too many reasons that somebody could not take hepatitis C medicine at this point, but not all providers know that. Providers have competing priorities. They think another diagnosis is more important than this, and then just limited time. There is a lot of time that is required on the provider side to take care of somebody with hepatitis C. Insurance access, availability of providers, this is all the system stuff, insurance access, availability of providers, payer restrictions, payer requirements like prior authorization. Here at FIGHT, we have an entire team to help support the provider to take care of the patient. We have a pharmacy team, we have patient navigators, we have intensive case management. So that time is divvied up between our staff here at Philadelphia FIGHT. Not every healthcare system is lucky enough to have what we have here. This is just a little picture. Healthcare silos are real. We have people who go to one place for mental health care. We have another problems with prescription coverage, and then they're somewhere else for physical health. Dental health might be somewhere else. But here at FIGHT, we've done our best to integrate healthcare. The See a Difference program is centered in the John Bell Health Center, which provides a safe space for people to access culturally competent, comprehensive primary and subspecialty medical care, regardless of the individual's insurance status, ability to pay, or life circumstances. Our team of compassionate providers focus on addressing each patient's unique needs and challenges. We also provide, I mentioned before, we do YHEP and LAX takes care of hepatitis C, and all this is very true for every single site. At John Bell, you can get a practitioner examination, you can do medical history, diagnostic testing, cancer screening, screening for STIs, HIV, hepatitis B and C with treatments if you need it, screening and preventative care for diabetes and hypertension, mental health screening and referrals, smoking cessation, referrals for specialty care, cervical and breast cancer screening, case management, community health worker services, behavioral health consultants, PrEP counseling, and also MAT services. So we do try to bundle everything here at 1207 Chestnut that you could possibly need. Care is individualized and carefully tailored to meet the needs of each patient and provided regardless of citizenship, sobriety, and insurance. Harm reduction care models are practiced at each clinic. Cross-disciplinary and multi-center weekly Hep C huddle occurs, including providers and support staff from both FIGHT and the Philadelphia Department of Prisons. So at 8 a.m. every Friday, our team gets here bright and early so we can talk about every single patient who has been approved for hepatitis C medication and make sure that they are getting what they need as a whole person. Social services, on-site pharmacy, patient navigation, re-entry support, behavioral health services. I know I'm repeating myself, but it's just so important to have all of this at one place. Medical case management. We also do pediatric and adolescent medical care, and dentistry are available at FIGHT for all patients. Something else that really helped us with providing care through the pandemic is having a mobile FibroScan unit. The FibroScan is what we use to measure the liver health of somebody. It's kind of just almost like an ultrasound. It's a little ping that goes through your ribs to your liver, and it tells the doctor if you have cirrhosis or not. So that let us get out and meet patients at the community partner sites and in the jail and kind of build a relationship with them while they're still incarcerated or institutionalized. It also helped kind of cut down on the fear people had about coming to the doctor when the pandemic was at its worst. We could come to them, we were dressed in full PPE, we looked like, we were in hazmat suits, but it gave us an opportunity to put our hands on our patients, to meet our patients and tell them what we had here for them. We have a DOT model, which is called directly observed therapy. It's not like you might see in TVs where we're watching people put the pill in their mouth and swallowing down. But if you could take 30 days of medication home with you and you have the kind of home where it would work to have your medicine with you, that's fine. We'll give you the whole entire month. If you needed a day at a time, you could come here and we would safely get you your medication. If you could take a week, or if on Friday you take home Saturday and Sunday, anything that the patient needed, we made sure that we got them their medicine so they would be able to take it. It's a nurse-led program, meaning that you worked closely with the medical team, but it's patient-driven. The patient told us what they needed and we made sure they had it. Our team would go out into the community and draw blood and again provide the FibroScans if a patient cannot get into our office or wasn't comfortable coming into our office. And telehealth care is available for those with access to smart devices. And we've provided iPads to sites that do not have access to the tech required for remote visits. I just want to mention harm reduction. I'm going to read right off the slide that harm reduction is any positive change as defined by a person at risk for harm. It's meeting people where they are and providing the tools and information they need to keep themselves and those around them healthy. It provides non-judgmental care. It fights discrimination. It does not require abstinence from drug or alcohol. It is not against abstinence for drug or alcohol. And it also does not attempt to minimize or ignore the real and tragic harm and danger associated with illicit and illicit drug use. We make sure that all of our patients, especially the ones who are still injecting or still drinking, know that we support them, and although we want them to use less or not at all, we'll help them use healthier, help them cut down, and help them be connected to people who can help them with those issues. The treatment cascade, or the kind of graph here that shows who needs care and who's in care, this is an old one. This is from 2014, but we know that these numbers are still true today. There's the 100%, the 3,500,000 people who have hepatitis C in the United States. Of those, only about 50% are diagnosed and aware of their condition. That may be a little higher in some communities that have programs like ours, but on whole, only about half of the people who have hepatitis C know that they have it. Even less have access to outpatient care, meaning that they can talk to somebody about being positive. A lot of people haven't had that second test, that HCV RNA test, to tell them that they have virus. This liver biopsy measure, we don't do liver biopsy anymore. We use that FibroScan, but not even 20% of people make it through the care cascade to have that done for them. Only about anywhere between 15 and 20% have been prescribed hepatitis C treatment, and only less than 10% have achieved SVR or cure. SVR stands for sustained virologic response, meaning that the medication killed the virus in your body and the virus stayed out of your body, it stayed dead. But when you look at what the See a Difference program is doing, you see that of the people who are RNA positive, we only test people if we're going to test them for virus. We make sure that people know their status when their test results come back. Of the people tested here at John Bell who have virus, 100% of them began their hepatitis C care. 91% have had their livers measured for damage. 76% were prescribed meds. 73% started meds, meaning they put that first dose in their mouth. 63% have completed meds, and almost half have achieved SVR, which means that we know that they don't have any virus 12 weeks after they took their last pill. In the community, it shows a little bit of a different story. Community tested patients may not have ever been here to Philadelphia Fight. So getting them through the door is a little bit trickier, making sure that they have the transportation, making sure that their kids are taken care of, their mom's taken care of, all of those patient barriers that we talked about earlier. So we see about 50 to 53% of people who were tested in the community began their Hep C care. Everybody who began their care is staged or is measured for liver damage. 40% prescribed meds, 37% started meds, and 28% completed them, and 21% we've measured them to make sure they still don't have virus after they finished. It seems like a low number, but it's an awful lot better than that 9% that we're seeing nationwide. Everybody should be treated for hepatitis C. So it's recommended for all patients with chronic hepatitis C infection, except those with short life expectancies that cannot be remediated by treating hepatitis C by transplantation of the liver or by other directed therapy. So we want to treat every single person who is not in hospice care or any other kind of end of life treatment. Treatment has come a long way. Back in the olden days, some of you may be familiar with the interferon. It was 6 months of really hard drugs at first, but it only treated 6%, cured 6% of the people who started on that medication. As time went on, they said, well, 6 months doesn't work great. Maybe a year would work better. It was like a year of chemotherapy. It was a terrible drug. Mentally and physically, it just wore people out, and it still only cured about 16%. So you can see as we go up this little, the little ladder here, that until 2011, everything that they tried was only curing half or less than half of the people who were treated. In 2011, we had a drug that cured about 75%, and then now, and beginning in 2014, we're curing about 95% or more people who start their medication is cured of hepatitis C. So the drugs work, so we need to take them. Traditionally, we ask everybody to come to, this is tertiary care hospital, but that could be any healthcare center. We ask people to come from all over the place to a central place to be treated. But what we know is that we need to work in this central place and bring the services elsewhere. We need to be in the community health centers. We need to be in the prisons. We need to be in the needle and syringe programs, pharmacies, primary care spots, drug and alcohol clinics, and sexual health places. So that's really the crux of what we do, is bring the cure to the people no matter where they are. That's that remote care. Hepatitis C is quite easy to treat now, so that's why it's so easy to do it through telehealth or through a more remote care model. Adults with chronic hepatitis C infection, all genotypes. That means any type of Hep C. I don't think I had a slide earlier, but there's 6 general types of hepatitis C. The medicine works for every single type. So all adults with chronic hepatitis C infection who do not have cirrhosis and who have not been previously treated can be treated very simply. There is some special attention that needs to be given to those with prior Hep C therapy, with cirrhosis or that hardening of the liver, end-stage renal or kidney disease, HIV, hepatitis B, current pregnancy, and prior liver transplantation, but it can still be done almost completely remotely. That's that telehealth care model. Anyone with access to an audio-visual enabled computer, that's like the computer I'm at, is a desktop that has a microphone and a camera attached to it, or smart device like an iPad or a smartphone, can engage in remote telehealth care. Philadelphia Fight supplied iPads to our 2 largest community partners so that patients receiving services at those sites were able to connect remotely with their providers, their Philadelphia Fight doctors during video health visits. Our patients had access to all services provided at Fight, especially those found at the John Bell Health Center and Institute for Community Justice during the pandemic because of the way that we've set things up to work remotely. And we do hope that continues. There are some questions about whether insurance will continue to reimburse for remote healthcare. And we do a lot of advocacy work to make sure that continues because we know it works. This is a telehealth model, Hep C care cascade at Kirkbride. Kirkbride is one of the largest recovery centers here in Philadelphia. We've been, and we meaning Philadelphia Fight, has been embedded at Kirkbride probably as long as Fight has been here, for over 30 years, providing HIV services and now HIV and hepatitis C services. During the pandemic, during not the whole pandemic, but when we started doing telehealth care in January of 2021, through April of 2022, we've identified 539 people who were living at Kirkbride and also living with chronic hepatitis C. Some folks just didn't make it into care. 165 were discharged before meeting with their navigation appointment. That happens because people are there for a short-term detox, or they decide that they don't want to be in inpatient recovery, so they leave. 81 folks refused hepatitis C care. We don't keep hostages here. It's completely voluntary. We know that some folks just aren't in a position to be cured at this time. We make sure that when they refuse care with us, we let them know their options. We let them know how best to take care of themselves and their loved ones. Make sure that they don't spread hepatitis C and make sure that they do everything they can not to get sicker. And we give them a ton of printed materials so they can call us when they are in a place to be treated. And then 17 were in care elsewhere at the time that they came to Kirkbride. So that leaves 276 people, or about half of the people who were living with hepatitis, met with our navigation team. 75% of those who met with our navigation began hepatitis C care, and 106, or about half of those who met with navigation, started their medication while in Kirkbride. It's a completely 100% remote care model where the doctor does not ever, as long as you're in good health otherwise, they never lie hands on you. It's all done on an iPad. And it works. Just a note that the interferon is gone in the United States. There's still some ribavirin interferon as that drug that's really, really hard to take. It's hard on your body. 95% or more people can be cured of hepatitis C. There's no longer any difficult to cure populations. We run into a lot of folks who say, well, I'm Black, so I can't be cured, because there was a genotype in the African-American population in the United States that was harder to treat before we had the kind of drugs that we have now. People who have HIV can certainly be treated for their Hep C. People who inject drugs I mentioned they're great at taking drugs, so it works really, really well in the injection population. And there's no counterindication for street drugs with hepatitis C medication. So just about any street drug that you're taking will not, well, I can't think of any that will make your hepatitis C medication not work. There is a genotype 3 that remains a little more challenging, but not by much. And the doctors can still cure the people with genotype 3. It's just a little bit more medication. You can be cirrhotic, and you can even have liver decompensation and still be cured. You can be older, you could have kidney problems, you could have somebody else's liver in your body, and you can be cured. Cost and access issues still persist a bit, not in Pennsylvania, but in other places. It is not $1,000 per pill, and there are no sobriety or illness restrictions in Pennsylvania. Here in Pennsylvania, everybody who has virus can be treated for hepatitis C, and most people can be treated remotely. They don't even have to go to the doctor, as long as they're getting their labs drawn and as long as they have a program like ours in place wherever they are, whether they're at home and being seen remotely, or incarcerated or institutionalized and being seen remotely. This is just a little graphic about some of the places that it is harder to get treated. There's 32 states that have eliminated or reduced fibrosis restrictions, means how healthy your liver is. It used to be here in Pennsylvania that your liver had to be very sick before we could treat you. So we would test you and we would tell you that you have virus, and then we'd say, well, you're not sick enough to treat because the insurance won't cover your medication. So we would just have to sit and watch people get sicker and sicker for years, knowing that if they were engaging in risky behavior with other people, they were able to give that virus to somebody else. If you have virus, you can give it to somebody else. If you don't have virus, you cannot. So when you're cured or cleared, you can't give somebody something that you don't have. So it was really, really awful to work in this kind of work prior to, I think it was 2017 when they dropped that restriction. 21 states have loosened sobriety restrictions. 28 states still have restrictions. So we have to, we have a little bit of work to do to get that lifted nationwide. And then 25 states have scaled back prescriber restrictions, and 18 still have pretty strict subscriber, meaning that your primary care doctor might not be able to treat you if you live in one of those purple states. But here in Pennsylvania, your primary care doctor can treat you. You're a subspecialty care person like a hepatologist or infectious disease provider can treat you. Nurse practitioners, physician assistants, anybody with a medical license can treat your Hep C. You don't have to be sober, and you don't have to have a long-standing infection and a very sick liver. There is a call to action. It is possible to eliminate hepatitis C. The treatment guidelines say that we need to test and treat hepatitis C. The direct acting agent, DAA, is just an abbreviation for the type of drugs that hepatitis C care uses for people who inject drugs. PWID is people who inject drugs, is effective. Reinfection can happen, and so we treat a critical mass of folks and scale up harm reduction, but that's okay. You can be retreated many times. We have people on their 4th or 5th course with us, and we know that not everybody is going to stay sober or inject safely every single time or have safe sex every single time. So we're here for everybody, no matter how many times you're reinfected or how many times you don't complete your medication. Treatment is prevention. Treatment benefits the patient and the community. So we want to get as many people treated as possible, and we want to make sure that we have as many treatment options as we need. Again, on-site, off-site, remote. We want the integrated models of care. We want everybody to get everything they need in one place. We want to make sure that care is accessible to every single person living with hepatitis C. There are available resources. A quick Google will get you those resources, or I'll give you my information. I love to talk about that. We can talk offline. We want to work to eliminate the barriers, the stigma, discrimination, and even some of the violence that we see against folks living with hepatitis C. And just a little note to act locally and think globally. Everything we do here at home will make the world a better place. Here is the information line for our team for hepatitis C information, testing, or treatment at Philadelphia Fight. Please call one of these numbers. You'll catch Jelena or Letitia, and they can set you up with an appointment, answer your questions. Appointments are in person or virtual. And for more information, you can always give me a call, an email. You can come find me here at Philadelphia Fight. I'm in person most days, Monday through Friday, 9 to 5. Thank you so much.
Thank you, Laura. Wonderful presentation. All right. So if anyone has any questions or any insight they'd like to share with Laura, or like to say anything wonderful about the presentation, you can do so now using the Q&A box. We'll give it about a minute to see if anyone has anything they'd like to share. Felicia said, thank you for a great presentation. Thank you, Felicia.
Thank you. No questions means I must have talked a whole lot.
Yeah, it was a wonderful presentation, very insightful. I feel like it's really important to talk about all of this, especially with all of the different things that people are navigating with public health. So
yeah, I can't say it enough. We just want everybody to get the care that they deserve. We've expanded our scope from being a hepatitis C only program to just taking care of all humans for whatever they need, because we've found in the last 2 years that people have priorities that are not hepatitis C. And when they come here to fight and we're taking care of their STIs, which are much more uncomfortable than hepatitis C, or their dental issues, they get to be in a place where they're ready to say, you know what, let's do that hep C treatment. I can do that now.
absolutely. All right, we're going to give it about 1 more minute. Again, if anyone would like to share anything, you can do so now using the Q&A box. All right, thank you to our panelists for your wonderful presentation, and thank you to all of our viewers for joining us today. And please join us for our upcoming presentations. Thank you, take care, be safe and well, and have a wonderful day.
Thank you.